You like nasal surgery.
Oh, I love nasal surgery because it's very technically challenging. It's very specific, and it's intricate. And the nose is the center of your face, so people look at your nose all the time. And I tell you that I've actually, like for example, I've had a young girl who was shy, introverted, kind of didn't do well at school, and we took a little hump off her nose, and within a year she was a president of her student activity council. She became the valedictorian of her graduating high school class. I mean, just changed her life completely. So if you don't like your nose, you got to do something about it, and you can change it.
Are there a lot of people that don't like their nose?
Oh, there's a ton of people that don't like their nose. And a lot of people don't like it, then they talk to their families. Their families say, oh, you look great the way you are. We love you the way you are. Just leave it alone. I mean, but it still bothers them. And then they don't do anything about it. And it takes years sometimes for them to get down to actually doing something about it. But then they do. They just say, I wish I did that earlier. I hear that all the time.
Is that
I wish
right?
I did that 10 years ago. I should have done that so long ago. I hear that all the time.
I've had plastic surgeons on this program because we are all over the U.S. and Canada. And I have guys that say I don't like doing noses. I've even been told that you have to make sure you get it right the first time. And that's why they like to stay away from it. Why do you like doing noses? Well, you say it's technically demanding, but is it because you're good? I mean, you feel you're good at it?
Well, again, because I said to you in the beginning, I like plastic surgery because of the art of it, the challenge of it. It's really, that's why I enjoy doing it. And so, again, if you take a challenge and put it in front of you, and you want to kind of beat that challenge. The noses are challenging because, again, they're very intricate, and you're right in that you want to do it well the first time, because second, third, fourth time it just gets worse and worse. Doing a round-of-fly, the first time's your best shot to do a nice job. So you want to do it well the first time, and that means you got to take a little time, and every little detail has to be addressed. So you got to make sure the breathing issues are dealt with. You got to make sure the tip looks perfect. You got to make sure the hump is, if there is a hump, is gone. You got to make sure the width, the height. Usually there's at least 20 or 30 different variables on a nose that are going to change when you operate. And so the challenging part of it is, one, the patient and you have to be on the same page and really understand all the changes that we're trying to achieve.
Can you give them an idea through imaging or whatever to let them know what it's going to look like? Because that seems like that'd be the fear.
Yeah, 100%. I mean, what I always tell these patients is we need to, and before, what I do first is I actually walk through and explain them the anatomy of the nose, and I show them what I'm going to do. Then we photograph them. Then we change their nose the way I'm envisioning it, based on the photograph and what I think they want.
You change it how? On
a computer. We'll
like
actually
software?
Software. We can actually morph it, change it, and say, this is what I think you want.
And what do they think? What do they say?
And it's really interesting. I think it's critical to do this, because a lot of times they tell me what they want. We do the morphings on the software and we change it. Like they say, okay, I just want my hump off. So we take the hump off. Okay, what do you think? They go, you know what? Yeah, it doesn't look as good. I actually maybe want that tip rotated up a bit. You're right, Dr. Kaila, we should rotate the tip up a bit. And I said, see? So we rotate it up. They go, yeah, that's much better. So but after seeing what happens with what they thought they wanted, they realize they do need, and that's really important and critical to do before you do surgery. Because otherwise, in the old days, without the computer available to us, they'd come back after surgery and go, no, I want it up.
So they had to take your word for it in the old days.
Yeah, and ultimately they have to understand, you have to understand 20 or 30 different changing variables, which is not that easy to do. And you're trying to talk to this patient about it, and a picture is worth 1,000 words. It's so true.
It's pretty accurate.
Yeah, so if you can show them a picture, and then you say, okay, you told me you want your hump off, you want this thinner, you want that pulled up, let's do that. And you do it, and then you look at it together and say, do you like it? And sometimes they say, no, I don't like it now. Well, that's great that we just did that, because that would have happened, in the old days, that would have happened after your surgery, and I don't like it now.
Did they ever say, I want that?
Yeah, sure they did.
Like they get so excited.
Yeah, then you say, yeah, okay, now let's change this way, and they go, yeah, that's perfect, exactly what I want. So now you know that what's in their mind and what's in your mind, because that's really what has to happen first. Surgeon and the patient minds have to kind of meld.
How often do you match it up, where at the very end it matches the photo imaging that you showed them?
Oh, I'd say virtually, as we spend the time imaging and getting what they really want, we don't, if we can't do it, we just don't do that surgery. So basically we always get them to match up to that.